So today we're going to be talking about the purpose and use of panoramic imaging.
The panoramic image provides the dental radiographer with an overall view of the maxilla and mandibule and is often used to supplement bite-wing and paracipal images. The panoramic image is typically used for the following purposes.
So the panoramic evaluates everything from dentition and impacted teeth to detecting diseases and even lesions.
Alright, these are the panel fundamentals. In panoramic imaging, the receptor and the X-ray tube head move around the patient. The X-ray tube rotates around the patient's head in the opposite direction. This process is called tomography. Tomo means view a slice of structure, and graphy means the use of examining. Imaging of one section while blurring images of structures in other planes.
The equipment used is an X-ray tube head, a head positioner, and exposure controls.
For a patient preparation, you would need a lead apron with no collar because collars will give you a white line, right? You want the patient to remove any jewelry, appliances, earrings, necklace, if they have nose piercings, glasses, dentures, anything that's in the mouth. For patient positioning, you want them to bite on the bite block, lips closed, tongue on palate. Stand tall, otherwise you have an error. You want the mid-sagittal plane parallel to the floor and the Frankfurt plane parallel to the floor.
Okay. Panos are used to view conditions that can't be seen easily or intraoral films. You can see impacted teeth, lesions, jaw fractures, and eruption patterns.
So these are the top 3 errors and causes for those errors. So if the tongue isn't on top of the mouth, it distorts and it cuts off the apex of the anterior teeth. If the lead apron touches the back of the pano machine, it turns the image white. And then if the patient moves, it causes the picture to be blurry, and then we must instruct the patient to be still. There are a couple more, but those are just the top ones.
So I'm going to be educating you on advantages and disadvantages. Some advantages of the panoramic imaging is that it's simple, minimal exposure, large surface areas, and patient acceptance. Some disadvantages are images aren't sharp, you can't diagnose decay or periodontal disease, distortion, and the equipment is expensive.
Yes.